Hi class, I'll be doing my presentation and it's about the Family First Prevention Services Act. This was a bill that was introduced in January 2017 and it became law in February 2018. This law has been passed at a federal level in order for different states to utilize the federal funding. They will have to invest on evidence-based practices as well as invest on training different staff members. The reason why it's important for different staff members to get the best training possible is because when the family is in need and keeping the family together is being dependent on the services, you want to be able to provide the best that you're able to. Therefore, training staff members is really important in my opinion. So what this law is looking into doing and working on is keeping families together. Let's say, for example, if a child or a youth is at risk of entering the foster care system or is at risk of going into a group home, what the services are looking to do is keeping the families together and provide services for the family member who is struggling. For example, it could be the caregiver or it could be the adult in the family that is taking care of this of the child or the youth. They will be able to receive different services, and the services are 12-month services. The services are in forms of parenting skill services, mental health services, and also substance abuse services. Another reason why I think this is important is because there are 437,000 children in the foster care system. 61% of them is due to physical abuse, 37% of them is due to substance abuse, and 14% of them is due to lack of parenting skills, just lack of knowledge on how to take care of their child, neglect. So that is the reason why it's important. I was able to make a phone call to the NASW, the California chapter, and I left a message. On that message, I was able to thank them for listening to the message to start with, and also I was able to let them know the importance of keeping families together, the importance of stability that having a family will bring to a child, and the stability that having a healthy family and healthy family members could mean for a child, for them to have a bright future, like a better future. That was one of the things I talked about. Also, I was able to mention about prevention funding. If this is a law that is going to be implemented in different states, it will bring prevention fundings into the states, into different states. And then what this prevention fundings are is basically mandatory fundings that are looking into promoting the public's health. So that is also important. But yeah, overall, I believe that this is an important act. I work with children and youth, and along with them are their family members who are also getting services. By having them together, you can tell the difference that makes in a child's life. But yeah, this is my presentation, and I hope I provided enough information for everybody to think it's as important as I think it is. Thank you so much.